We want you as a parent to understand that every treatment plan has to have these 4 components, or it's not going to work. Component number 1, you've got to get a good evaluation. You have got to see an appropriate, knowledgeable professional. It doesn't matter whether it's a developmental pediatrician, a child psychiatrist, a child psychologist, or a behavioral neurologist, as long as they are well-trained and knowledgeable about ADHD. That's the trick. It's not the degree. It's the knowledge, it's the training, it's the experience. Do they see lots of ADHD kids and families or adults? So we need an evaluation because 80% of these people have another disorder, and that's going to need to be treated as well. Next, families need to educate themselves. We'll talk more about that. But you need to become an expert about ADHD or you're not going to know how to deal with it. Attending this afternoon has been a big step in that direction. Third, you need to understand that medication is the most effective thing we have. And that doesn't matter to me whether you like that or not. That is a statement of fact. We have no more effective interventions than these medications, which is why in the last decade we have moved them up in our priority of using them. It used to be that we would try everything else under the sun first, and only if they failed, go to medication. Well, guess what? 80% of them failed, and we went to medication anyway. And we should have started with it to begin with, because it would have made them more amenable and more susceptible to the other psychosocial educational programs we were trying to do. So don't be surprised to learn that up to 80% of ADHD children will be on medication at some time in their developmental period, whether that is childhood or adolescence. Because there are times and places where you cannot institute a psychosocial treatment. If your child is driving home from the homecoming last night, which was over at the Delta Hotel, by the way, I checked in and there's a prom going on, you can't be there handing out tokens for following the speed limit. You know, this is idiotic to think that behavioral interventions are as good as medications. They're not. Where they're done, when they're done, they're good. But there are places where they can't be done. And now what do? The medications fill those gaps. So that's why we use them, and that's why you're seeing medication on the increase in both of our countries. And it is completely rational to do so. Then we make accommodations. That's what I meant by altering the points of performance using those 5 strategies we talked about, externalizing information. You need to create prosthetic devices in these places to help them show what they know.